Welcome to Have More Babies. Today we're getting into something that, well, it really touches every parent's heart and mind, our children's mental well-being.
Hmm.
It's an area that can feel, incredibly overwhelming, maybe a bit mysterious sometimes.
Definitely.
But what if I told you that your child's pediatrician, the doctor you see for checkups and colds, is often the most accessible and maybe the most effective first line of defense?
That's such a key point.
We're taking a really close look today at an insightful article from Omega Pediatrics. It's called The Role of a Pediatrician in Mental Health Care.
A really good resource.
Yeah, and our mission today is basically to uncover how these doctors, these vital doctors, are actually so much more than just, providers of physical care.
Right.
They're really guides for your child's holistic health, helping you connect dots you might never have seen before.
Exactly.
So hopefully you'll walk away with a clearer understanding of how physical and mental health are just so deeply connected. We'll talk about specific signs to look for, and crucially, who you can turn to for support. Let's unpack this important information.
How's it go?
So when we think about our kids, their physical health almost always takes center stage.
Oh, absolutely. Scraped knees, coughs.
Yeah, are they eating their veggies? That
Yes.
kind of thing.
Right.
But this article we're looking at, it highlights something really fundamental, something we probably overlook quite a bit.
Mhm.
Physical and mental health. They aren't separate things. They're deeply, intricately linked, like two sides of the same coin.
It's fascinating how the article really emphasizes this bidirectional relationship.
Bidirectional. Okay, what does that mean exactly?
Well, think about it like this. Imagine a child dealing with chronic pain, maybe from, recurring condition or an injury.
Okay.
That constant discomfort isn't just physical, right? The stress of managing it day in, day out, the limits it puts on them.
Yeah, that must be exhausting.
Exactly.
Yeah.
It can silently chip away at a child's mental resilience. It might make them more prone to developing anxiety or even depression.
Wow, okay.
And then conversely, we often see the mental stuff showing up physically.
How so?
Well, a child who's feeling really anxious or depressed might not have the words to say it,
Right.
but instead, their body might kind of speak for them. You might see recurring stomach aches or headaches that keep coming back, or maybe digestive issues.
Mm-hmm.
With no obvious physical cause. It's a powerful reminder that their well-being is, well, it's truly indivisible.
Indivisible. I like that.
Yeah. And this connection, it impacts everything. School performance, their daily lives, how they interact with friends.
So you can't just focus on one without the other.
You absolutely can't. You really need to consider both equally to, help them succeed and be happy overall.
That's such an important point. So thinking about that deep connection, for us as parents, what are the subtle things we might be missing?
Mm-hmm.
What should we really be looking out for beyond just the obvious scraped knee or cough?
Exactly. Means paying attention to those subtle cues, like you said, a physical complaint that keeps popping up, especially if doctors can't find a clear reason for it.
Yeah.
That could very well be a window into a mental health challenge.
Okay.
And, on the flip side, changes in their behavior, their mood,
Mm-hmm.
those could show up as physical discomfort.
Yeah.
It's really about looking at the child as a whole person, not just like isolated symptoms.
Right, the whole picture. Okay, so we've established this vital connection. The next logical step for parents then is understanding what specifically the pediatricians are looking for.
Mm-hmm.
What are those common concerns? And maybe more importantly, what are the practical signs we can actually spot at home that suggest something more than just, a bad mood or a phase?
Right. And our source, it cites the CDC, explains that pediatricians are actually very well equipped to address a whole spectrum of mental health concerns right from the get-go.
So it's not just specialists we're talking about.
No, not initially. They're often the very first professionals to identify and even start managing conditions that might surprise you.
Like what, for instance?
Well, for instance, they frequently encounter attention deficit hyperactivity disorder, ADHD,
Okay. Yeah.
where a child struggles with attention, maybe impulse control or hyperactivity,
Right.
and things like Tourette syndrome, with the sudden involuntary night aches.
Mm-hmm.
That might seem rare, but pediatricians are trained to spot it. They also deal with OCD, obsessive compulsive disorder.
Right, the repetitive behaviors?
Yeah, persistent thoughts, repetitive behaviors,
Hmm.
and PTSD, post-traumatic stress disorder, maybe from a traumatic experience leading to flashbacks, nightmares. That's all within their scope to initially assess.
Okay. And what about things like anxiety and depression? Those seem so common now.
Absolutely. Anxiety, that persistent feeling of fear or dread and depression, the continuous sadness, lack of motivation, they are definitely on their radar.
Mm.
And even for more challenging behavioral patterns, like oppositional defiant disorder, ODD,
What's that exactly?
that's where a child shows. Like
Mhm.
a consistent pattern of being uncooperative, maybe hostile towards authority figures.
Okay.
And conduct disorder, or CD, which is more severe, involving aggression, rule breaking. Those are also things they look out for. Plus, autism spectrum disorder, learning disabilities, signs of self-harm, and even substance use concerns.
That's quite a comprehensive list. It really covers a lot.
It does.
And it makes me wonder, if a parent is listening right now, maybe feeling a little knot in their stomach thinking, my child does that sometimes.
Hmm.
What are the patterns or the intensity? What makes it more than just a phase and signals it's time to call the pediatrician?
That's a crucial distinction, absolutely. The article gives a pretty clear list of behavioral changes that, if they're happening frequently, if they're persistent, and if they're really affecting a child's daily routine or their happiness,
Okay.
then that should definitely signal a deeper problem.
What kind of changes are we talking about?
Well, these include physical symptoms, like we mentioned, unexplained headaches or stomach pains, maybe rapid breathing, or digestive issues that seem tied to stress or anxiety. You might also notice really disrupted sleep patterns, like constant trouble falling asleep or staying asleep, or maybe they're super tired all the time even though they seem to sleep enough.
Right. Sleep is a big one.
Huge.
Yeah.
Other key indicators are persistent, uncontrollable worries, often about things that might seem minor to us adults, or an increased tendency towards isolation, pulling away from friends or activities they used to love, constant nervousness, maybe agitation, or actively avoiding certain situations or places out of fear. Oh, those are red flags too.
And what about things like eating or school?
Good question. Definitely watch for changes in appetite, eating way more or way less than usual, or maybe easily giving up on tasks that they find challenging. Struggling academically when they didn't before, a consistently low mood, being irritable or sad much of the time, experiencing intense guilt or self-blame that seems kind of out of proportion to the situation. These are all significant.
Yeah.
And, most critically, host speaker. Any expression of thoughts or feelings about death or suicide,
Right.
that should always be taken seriously. Always. And addressed immediately with a medical professional.
Absolutely. No hesitation there.
Recognizing these patterns, it isn't about you diagnosing your child at home.
Of course.
It's just about knowing when it's time to seek that professional guidance.
That's incredibly practical advice. Really helpful. So, okay, this raises the next important question. Once we've noticed some of these things and we actually bring these concerns to our pediatrician, what happens then? What can we expect? How do they actually approach mental health in their office? It often feels like such a specialized field.
Yeah, it can feel that way, but the article details a pretty structured yet compassionate approach. Your pediatrician kind of acts like a medical detective here. They'll start by asking a lot of questions about your child's mood, their behavior at home, at school, any changes you've noticed over time. They need that holistic view.
Right. Gathering information.
Exactly. And they might use standardized screening tools.
Screening tools, like questionnaires.
Pretty much. They're essentially scientifically validated questionnaires or checklists, sometimes for parents, sometimes for older kids too. They help assess mental health status in a more quantifiable way.
Ah, okay. To get some objective data.
Precisely. It
Yeah.
puts some objective measures to what can feel like very subjective observations from a worried parent.
Makes sense.
So if based on these initial talks and screenings, a mental health disorder is suspected, then they'll likely conduct a more thorough pediatric mental health evaluation.
And what does that involve?
Well, it could include more specific psychological or developmental screenings that really dig deeper into the particular areas of concern. The main goal is just to gather enough information to understand the full picture before deciding on next steps. And based on what they find, they don't just, stop there. They actually develop a mental health care plan.
A specific plan for the child.
Yes, tailored specifically for your child. This plan might involve recommending psychotherapy, talk therapy, or it could include medication management if that's appropriate for the child's age and the specific condition. It often brings in other mental health support services too, depending on what's needed.
Okay.
And importantly, if the issue turns out to be really complex, or maybe it needs expertise beyond general pediatrics,
Yeah.
the pediatrician will refer you They'll guide you to a specialized mental health professional for a more accurate diagnosis and, higher level clinical management.
So they really are the starting point and the guide.
Absolutely. Your first line of defense and your navigator through the system.
That's so reassuring to know that our pediatricians are such a vital starting point, really an anchor for our kids' health journey. But it sounds like, as you said, there's a whole network out there beyond the pediatrician's office.
There is.
Who exactly are these other specialized mental health professionals? And how do their roles differ if, say, a referral is needed? It can get confusing.
You're right. It can feel like a bit of a maze with all the titles. But the article clarifies it nicely. It outlines several types of specialized professionals who can offer further support.
Okay.
So first, there are developmental and behavioral pediatricians.
Okay. Developmental and behavioral.
Right. This is a subspecialty, and they're focused really intensely on developmental or behavioral challenges. They have specific extra training in assessment, diagnosis, and making comprehensive treatment plans. And they often work really closely with your primary pediatrician on those more complex cases. Think of them as like the next layer of specialization when development or behavior is the main puzzle.
Got it. Who else?
Then you have child and adolescent psychiatrists.
Psychiatrists. Okay. They're medical doctors, right?
Exactly. They're MDs who specialize in recognizing and treating mental health issues in kids and teens, things like depression, anxiety, bipolar disorder. And crucially, they are the ones who can prescribe and manage medication if it's deemed necessary.
Ah, okay. Medication is their domain.
Primarily, yes. Then you have clinical child psychologists. They typically hold PhD or PsyD degrees.
So not medical doctors, but doctors of psychology.
Correct. They have deep expertise in children's mental health. They do therapy, assessments, and they often collaborate with psychiatrists if medication is also part of the treatment plan.
Okay, so they work together sometimes.
Often, yes.
Yeah.
Then, for concerns related specifically to the nervous system, a neurologist might get involved.
Neurologist.
These are medical doctors specializing in the brain and nerves. And then, slightly different but related, are neuropsychologists.
Neuropsychologists, how are they different?
They're highly focused on evaluating brain structure and function. They help assess cognitive abilities, learning styles, problem-solving skills.
Like for learning disabilities.
Exactly. That's vital for understanding the root cause of issues like learning disabilities or certain mental health challenges that might have a neurological component.
Interesting.
And let's not forget the school setting. School psychologists are right there in the schools.
Right, part of the school staff.
Yeah. They help students with mental health difficulties, using school records, talking with parents, making recommendations for maybe classroom support or further evaluation. And finally, you have licensed clinical social workers, LCSWs or LMSWs.
Social workers, okay.
They usually have a master's degree in social work. They can evaluate mental health status across all ages, diagnose conditions, and create treatment plans. They often provide therapy, too, sometimes with a real focus on family systems and the child's environment.
Wow, okay. That really is a comprehensive network.
It is. And your pediatrician is the one who can help you navigate it, help find the right fit for your child's specific needs.
That's an incredible overview. It really helps demystify that whole referral process. Thank you.
You're welcome.
So it's clear that professional help is invaluable, right? But the article also really stresses the critical role of the family, the home environment.
Absolutely fundamental.
So what can we do every single day right there at home to proactively support our children's emotional well-being?
Yeah, the article gives some really practical, healthy coping strategies. It reinforces that the family plays this huge foundational role. Firstly, and maybe most importantly, practice open communication.
Okay. More than just, how is your day?
Exactly. That often gets you a grunt or a fine.
Right.
Instead, try to create a truly safe space. Maybe ask things like, what was the trickiest part of your day? Or what made you laugh today?
Oh, I like those.
Yeah. Encourage your child to talk openly about their feelings, the good, the bad, the worries, the joys, and really commit to listening without judgment or criticism. Just listen.
That's huge. Okay. What else?
Secondly, foster positive relationships. Let your child participate in activities they genuinely enjoy. Help them build strong, supportive connections with friends, family, other positive figures in their life.
Those social bonds.
Incredibly protective.
Yeah.
They build that sense of belonging. Thirdly, encourage a healthy lifestyle. This is just basic, but so important.
The fundamentals.
Right. A balanced diet, getting enough sleep, which is huge for mental health, often overlooked, and regular physical exercise. These aren't just good habits. They're like fundamental building blocks for emotional resilience.
Makes sense.
Being a role model yourself is also crucial.
Oh, yeah. They're always watching.
Always. So show them healthy ways to cope with stress, how you handle pressure, how you talk about your own feelings. That has a profound influence. If you model calmly handling stress, they learn that's possible.
Right. We teach by doing.
Exactly. And finally, don't ever hesitate to seek help when you need it. If you're worried about your child's mental health, talking to their pediatrician is always the best first step for guidance. All these steps together, they create that safe, supportive, nurturing home environment. And that's truly the foundation of emotional well-being.
Wow. That was really eye-opening. It's such a powerful reminder, isn't it, that our children's mental health is just as vital as their physical health.
Absolutely.
And often, it's all connected in ways we might not even initially realize.
Mm-hmm.
So for you listening right now, maybe just think, what's one small intentional shift you could make today, in your family's routine maybe, to foster a bit more open communication about feelings, especially now, knowing how deeply it impacts their overall well-being?
And remember, your child's pediatrician really is a key partner in this whole journey. They're equipped to offer support, guidance, and help you navigate that broader network of mental health professionals if it turns out you need it.
Absolutely. And if you are concerned about your child's mental or physical health, please don't wait. Omega Pediatrics is dedicated to comprehensive care. They even offer appointments until 9 in the evening, which is amazing for working parents.
That's really helpful.
Yeah. You can find more details about their services. You can read the article we talked about today and easily book an appointment by visiting omegapediatrics.com.
Let's spell that out.
Good idea. That's OMEGAPEDIATRICS.com. omegapediatrics.com.
We really hope this discussion around the source material has given you some valuable insights and maybe empowered you with knowledge to better support your child.
Yes, definitely. And if you found this conversation helpful, please take just a moment to like this video, subscribe to our channel, have more babies for more explorations into critical topics like this one. And please share this video with other parents, friends, family members who you think might benefit from hearing it.
Yeah, spread the knowledge.
Thank you so much for joining us today.
Until next time.
Bye for now.